Hey everyone, does your patient need a second opinion for Morton's neuroma? Typically I'm seeing patients that have had a failure of treatment to date. So, they've gone through all of their conservative therapy, it hasn't worked and they're looking for further options. This is a great opportunity to say, okay, here's potentially another conservative option, or whether they're looking towards potentially a non-surgical or surgical option that we can provide. If there's been no response to treatment after several visits, that's definitely what we're going to say, okay, time to get another opinion to, one, make sure it is a Morton's neuroma, and two, whether there might be a non-surgical or surgical option that we can provide for that patient. If they're in high levels of pain, even at their initial consult, and you're like, oh, I really don't like the look of this, more than happy to see them at that stage and really make sure that we get on top of their pain as soon as possible through our non-surgical or surgical options. If they've got pain that's impacting their activities of daily living, that's when a second opinion may be appropriate. So these are patients that are unable to walk and therefore unable to help cook, clean, undertake any of their normal activities that they need to survive during the day. They're the patients that we're wanting to be able to see sooner so we can put them back on the right track. If their ultrasound indicates a large Morton's neuroma, considering whether, if it's responding after a few sessions or not, but really these are the patients that we can really put a very fast acting, comprehensive management plan in place from a non-surgical right through to a surgical option. And so being on top of these type of patients early can mean that we get a better outcome in that longer term. If those x-rays indicate an abnormal metatarsal parabola, so maybe that third metatarsal is longer than the second, or the second's just incredibly short, then that's where we can potentially be saying, okay, well, there's other options or concerns that are occurring here. And that's where a second opinion for a potential surgical option or further appropriate offloading through an orthotic can be really critical to getting that patient out of pain as soon as possible. If the patient's unsure, they're wanting further advice, they're wanting that second opinion or information about surgery, that's where we come in, and we're more than happy to help all of our patients get to a quicker recovery and pain-free living as well. That's what we're all here for. And so do have a bit of a think about all of these options and whether you might need a second opinion for your patient with a Morton's neuroma. But in the meantime, hit the subscribe button, have a look at a few of our other videos, and I'll see you at the next session. Cheers.